Guys, welcome again to another video. My apologies for sending you a second one in as many weeks. There's been quite a few updates on this, and I thought I'd better send it over to you. Pardon me. For those who don't know me, my name is Dipper, and I'm here at Farmer Plus. And this again landed on my desk on Friday, as you can see. There you go. And it's an update on the London flu vaccination service. So again, it's something that I think you're going to need to know about. And there's a lot going on. It's taken me probably around about 2-3 hours just to get through everything and try to get a vague idea of what is it being expected. And I've had quite a few phone calls about this as well, so I just thought it'd be a nice idea to send something like this out to you. So on Friday, you probably would have received something similar to this, and on the bottom of that, you've had a zip file. Okay, so I'm just going to quickly open that up, and in that, you're going to have a number of documents, and this is what I think has thrown a number of people. There's quite a few things going on, as you can see. There's a number of user guides, there's forms, etc., as well. So I'm going to come back to that in a minute. But the one thing that I think you're going to find quite useful to have a look at is, I think it's this one here, which is the final SLA. So if I open that up quickly, all right. Oh, not that one. Sorry, we've already done that one. My apologies. It's this one here. Sorry. Okay, here we are. This is the London immunisation. It's essentially the operation guidance. So the first one that I just clicked on, by the way, we did a video of that last week. I'm not going to go over that again. This is essentially the operational guidance that I think is going to be quite useful for you to have a look at. So the idea really is to go over this with you, and I'm going to go over also some of the documentation as well that you're going to need to look at. And again, the format that I'm going to do is a similar sort of thing to what I did last week. I've highlighted a few of the passages that I think might be useful to you, and just to highlight some of the things that I think you might want to watch out for. Okay, so this is what I would like you to open up when you have a moment. Pardon me. And again, as you can see, it's about 20-30 pages long, so it's quite a large document. The first bit is obviously just an introduction. The first thing I'd just like to draw attention to is this little paragraph here. There's a likelihood that the start date of the national service might be a little later than the start of the flu season. This does actually have an impact upon the London service. The London service has started on the 1st of September 2015. As you can see, it's already started. The national one hasn't started yet, and that's going to have an impact upon what we'll discuss a little bit later on. So the London flu service essentially is in operation now. The national flu service isn't yet in operation, and today is the 7th of September. Okay, so that's the first thing I'd like to pull out for you. All right, so let's move on. Okay, so the next thing is getting your pharmacy ready, and I think this is quite a nice little table here, really. So just to go over a few bits here, just make sure you brief your members of the team. There's an implementation checklist which we'll go over in a minute. You need to make sure that there's arrangements for your waste bins to be collected. Ensure that you've got NHS posters on display, and I'll go over how you get those in a minute. And pardon me. Ensure that all the pharmacists that are accredited to provide this service are registered on Sonar as well. And all this detail will come on to a little bit later on. Okay, so first things first, let's have a look at the implementation checklist. Okay, when you go on to this page, what you'll see is you need to complete a registration. Okay, and this is the web page that you do it. So all of your pharmacies and pharmacists need to go onto that web page and register themselves. Now here you've got the next bit, which is training. Okay, now those of you who attended the free Pharma Plus training should be okay in terms of things like the basic life support and how to actually administer. Those of you who are new, it may be an idea, as we'll come on to a little bit later, to get somebody to observe you doing the vaccinations, and I think you can call your LPC to actually arrange that as well. Each accredited pharmacist needs to have completed this, so needs to have signed this. Now the important thing here, okay, so remember there's these four here. Okay, you don't need to send any documents to the NHS. Okay, so in other words, you can keep a file of that, but each pharmacist needs to have signed it. So what you'll need to do is you'll need to sign the National Advanced Service for Influenza when that's available. Remember, the national one isn't available yet, but it will be available soon. The NHS Influenza PGD, the immunizations core PGD, and also another one called the pneumococcal polysaccharide PPV23 PGD. Okay, now that's what each pharmacist is expected to sign. As contractors and as superintendents, you'd also be expected to sign the London Pharmacy and Immunisation Service SLA and also the National Flu Service SLA when it becomes available. That's basically service level agreements. That's you're agreeing to provide that service at that level. Okay, so after that, what you'll also need to do is pass the CPP immunisation. Okay, part 1 assessment within the last 3 years. The chances are you probably have passed this last year, because there's also a requirement then. Make sure you print off that certificate and keep it in the pharmacy. And this is where it tends to get a little bit complicated. I've had a few people phone me up on this one. There are some declarations of competence that you need to do, and you need to do 2 of them. Okay, so the first, remember, because if it's in London, you're going to be doing 2. You're essentially going to be doing the London flu service as well as the national flu service. So in other words, you'll need to do this twice. The London one, okay, which is not the advanced one, you'll need to sign off as competent on the CPP website, and also you'll need to do that the same for the national one as well. Okay, so you'll need to do that twice. I haven't quite gone on there yet, but you'll need to do it twice. Again, just make sure you do that. Okay, so that's about the declaration of competence here. All right, so I'm gonna move on. Okay, I'm actually going to delete that bit because we'll come on to that in a bit. Let me just do that. There we go. I'll come on to that in a bit. Pardon me. Now, there are a number of different forms that file that I opened up early on has got on it. So the first one is the patient vaccination form, and this form must be completed before the vaccination takes place. It's essentially their consent, as you can see it here. You can either do it on paper, or you can fill it electronically, but you do need to send it off either way. This is where it gets really complicated now as well. Okay. There are 2 record forms. Okay, there's a first one which is the combined record form, and we'll come on to that in a minute. And there's another one called the local one as well. Now, remember that the NHS National Service hasn't gone live yet. What has gone live is the London one. Okay, so if you think about it here, the combined flu vaccination form, okay, and the local, actually let's talk about the local one first. The local vaccination form, this form will come into use once the national service starts and if it requires a specific record form to be used for patient cohorts in the national service. At present, there are no details that have been released yet. Okay, so in other words, once the national service goes live, you will be expected to use the local form. Okay, at the moment, you'll be using the combined form, and I'll in actual fact, let me do it now. So if you look on here, okay, you'll see that I'm not going to open it up yet, but here you go. There's one local here. Okay, that's the London service, and also there's the combined service here as well. So combined form there. So just be on the lookout. Just be on the lookout for that. That really did confuse me. So it's something I think you do need to bear in mind. There will be 2 forms, and there is a difference between that, and that is the difference between the 2 of them. Okay, let's move on then. Okay, so this is an example of the combined form. Okay, when you open that up, and this is an example of the local form as well. They are slightly different, by the way. So make sure you do read through that. Okay. Oh, sorry, and finally, this is the PPV vaccination form as well. So, in case your patients need a PPV 23, PPV 23, then this form will obviously need to be completed as well. Okay, so the next things next. Okay, this is the eligible groups that we'll talk about. We went on to this in a bit more detail last time round. I'm not going to go into this in too much detail, but this bit here goes over what the national um, eligibility criteria are, and this bit here goes on to what specifically the London criteria is. Um, Bear in mind as well that because of the fact, remember the different services going on at the same time, it is likely that you might be using anything up to 3 PGDs for flu. Now, this means that, for example, you might be using one for the NHS National Service, you might be using one for the NHS Local Service, London Local Service, that is, and you might be using one for the private service as well. There you go, private flu. So, each one of these PGDs are just going to be slightly different, and you need to make sure that you understand which of the PGDs you're using at that particular time. So, if, for example, the patient adheres to this criteria for the National Advanced Flu Service, you'll be using that PGD. If they fall out of that service but fall into the London service, then you'll be using that PGD. If they don't fall into any of those, then you might want to go with the private PGD to make sure that the criteria there are met. So, all a bit quite confusing, but hopefully that's made a little bit more sense there. So, you could be using anything up to 3 PGDs for flu and another one for the PPV 23. Okay? Right, let's move on. And here you go. Here's the PPV 23 as well. Okay? And it's got the the inclusion criteria there as well. I'm not going to go into this in too much detail. Okay, so that hopefully explains this. Now, I've training requirements. Let's go into this. Now, remember I mentioned there's 2 potential declarations as well. I've this is my handwriting, by the way. It's just to note that if you're going to be doing the national one, you'll need to complete a declaration for that. If you're also going to be doing the London one, you'll need to complete another one. So you could have 2 declarations, and both are available on this website. So make sure you do log on to that. You'll need to print it and make sure that you keep it in the pharmacy. But also, this is something which I didn't highlight. This is something which I didn't highlight, which is a bit naughty of me. I'll do that now. You need to allow them access to something called CPP Viewer. And what CPP Viewer is essentially something that they can look at their end to make sure that you have signed that declaration. All right. Again, that's on the CPP website. Okay, so the next bit shows to you what you should have available for your inspection. Okay, if there's any monitoring visits, you'll need a copy of your basic life support certificate. You'll need your vaccination training certificate. You'll need your declaration of competence for the London service, and also another one for the national service as well. Okay, now the key documentation here. Okay, I'm not going to go into this in too much detail, but this bit here tells you where you can actually find all the relevant documentation. So the PGDs, for example, are available on the SONA website. The national PGD is going to be on the SONA website once it's launched from NHS England. The service level agreement for the London Pharmacy Immunisation Service, remember that's the one which the superintendent needs to sign off, is available on the SONA site. The service level agreement for the National Flu one, again, is available on the SONA site. Well, it will be available, I should say. And I'm not going to go into each one again, but it's you can probably get an idea as to where everything is. So have a read through that when you have a moment. It just tells you where the documentation is. Okay, some other bits now. Some guidance in terms of the service specification. Okay, so if you haven't been vaccinated before, okay, new vaccinators should either be observed or assessed. Okay, in practice, this means by an experienced healthcare professional or one which has been approved by the training providers, or you'll need to be signed off in an HPA immunization competency assessment. Now, basically, what that means, if you haven't done an injection before, give your LPC a ring, and they'll arrange for somebody to come and help you out with that one. Okay, so if you have never done it before, get somebody to observe you doing it by contacting your LPC. Now, the other thing is there is a difference of how you actually give the flu vaccination and how you give your PPV vaccine as well. The thing with a PPV vaccine is that it needs to be reconstituted. And I think Sanofi, from what I gather, are creating a video for pharmacists on how to prepare the PPV vaccine as well. So that should be available soon. And once we have seen it, we'll pass it on to all of you as well. Okay, guys. So there you go. That's an example of an assessment, competency assessment. Right. So some other things. Make sure you're all Hep B vaccinated. Okay. Make sure you've got a system of getting rid of clinical waste. If you haven't, contact your LPC. And also make sure that you have got the most recent algorithm for anaphylaxis resuscitation available as well. And that's the website that you need to do. Literally all you do is you just go onto that website. You'll see two different algorithms. You pick out the initial one, and that's what you download and print out. Okay, so you just do that literally by clicking on that. Actually, right, let me just show you now. Let me just click on that now. There you go. There you go. So I've clicked on that, and you've got, there you go. You've got the initial treatment one, which is the one I think you're gonna need more than anything else. Okay, right. Now, cold storage. Make sure that you've got a working fridge at least. Consumables, they are not going to be reimbursed by the NHS, so bear that in mind. Right, posters. Now, you should receive 3 posters. Okay, these sorts of sizes. They're going to be sent directly to the pharmacies by the 19th of September. And also, if you want more, you can download them as well from the platform, which is quite useful as well. Okay, now recording data. Again, I'm not going to go through all of this again, but again, when you go onto the Sonar platform, you'll be asked to record details. Essentially, it's a tick box exercise. You go onto the platform, click on New Vaccination, and you just literally fill in the form there as well. Now, this is something that I'm finding that I'm going to need to find out a little bit more information about, and I'm going to have a chat with somebody in the near future about this. But before I move on to this little question mark, I just realised I left this out. Make sure that when you give a vaccination, okay, that you let the GP practice know within 24 hours. Once you've loaded up the form onto Sonar, it should then send a secure email to the GP's practice. So and that's to avoid things like double vaccinations. It's to help ensure that communication is maintained and paramount. Now, this is one with this bit here is I'm a little bit concerned about, and I've raised a query with this, and I think it's the same issue for last week as well. So I'm just waiting for somebody to get back to me. Basically, patients of GPs who decline immunisation, ideally, the GP should be told. But I'm just querying things like patient-sensitive data, supposing they don't give consent for their GP to be informed. It's those sorts of things that I'm just a little bit confused about. So I'm in the process of raising this as a query, and as soon as I know the answer to that, I'll let you know. I mean, it must have been thought through, otherwise they wouldn't have put it onto the SLA. So I'm just checking through that. Okay, so okay, I should have actually highlighted this bit. You must must ensure that you have patient consent before you administer. I mean, that's just obvious. Okay, and you've got a consent form there as well. Okay, each time you administer, you need to give them a patient survey. Now, at the moment, what they're going to do is you can upload the data onto the Sonar platform, and what they're asking for as well, all hard copies of the patient experience form for the advanced service. Remember, this is the advanced service, will be sent to a national body, okay, by post. And it probably will be the NHSBSA, but They're still trying to figure it out. So for the London one, okay, you'll need to upload it for the Sonar platform. For the national service one here, you'll need to send it off to a local, a national body of some sort. Probably it will be the NHS BSA. It just makes sense to do that, but they're going to get back to us on that one. Now, the paperwork needs to be stored securely for 8 years from the date of vaccination. Bear that in mind. Incident reporting. If there is an incident, there is also, if I'm just going to put this one up here, there is a, where is it? It is, sorry, bear with me, I'm just trying to find it. There's a consent form, experience form. I'm just trying to find it. There is an incident form here somewhere. I just can't see it. Not that one, not that one. Here we go, that's the one, incident reporting form. So there is actually an incident reporting form there. So if there's an incident that occurs in the pharmacy, then make sure you complete one of those and send it to NHS England within 24 hours. Okay, I'm not going to go into that bit there. Vaccinating off-site. Now, there's no additional funding for vaccinating off-site, but you may feel it's appropriate to do so. And in the SLA that we discussed last week, there are some details onto what some of the things you'll need to consider if you're considering off-site vaccination as well. So have a look at that video that we did last week, and it should give you a bit more detail on that. Okay, and the rest of it essentially is frequently asked questions. So let's see if there's anything that I've highlighted. Here we are. Can I vaccinate any patients eligible irrespective of whether they live in England or whether their GP is in London? And the answer is yes. Okay, so you can do it. Can I vaccinate those patients, only those patients who live in the borough? Nope, you can vaccinate anybody you want to. Okay, as long as they fall into the categories. Okay, that's that. Let's see what else I've highlighted. This is a bit of a weird one. Okay, the NHS Public Health England Flu PGD. I have to work states it is for IM administration, in other words, intramuscular injection. However, the SLA and the flu record form seems to suggest I could use subcutaneous administration where appropriate. Can I administer by subcutaneous? The answer is yes, you can. It covers you for subcutaneous administration. Has been confirmed with the NHS England and the Public Health England as well. So you can actually use both routes if necessary. Probably IM is just a lot easier, so you might just want to use that instead. Do I need to see proof of a carer's allowance? Nope, is the answer to that. What guidance is there around inclusion of care home staff? Now, this is quite an important one. Care home staff are not covered by either of the NHS services for London or the National Advanced Service. Okay, that's for social care workers and non-NHS staff working in care homes. They need to have their vaccinations done by their employer. Okay. What constitutes frontline health workers? You've got a list here, things like pharmacists, dispensers, key staff. So you can do your staff as well. It's probably a good idea to do that. They'll get it free of charge, and also all of these here as well. Okay, you've got those there. Now, do eligible frontline staff need to have proof? Some organisations might give you a flu voucher or a letter. But ultimately, if you don't have any of that, you just ask some questions and you make your professional judgment. Okay. How will I get paid for the service? Well, basically, you need to enter everything into the Sonar system and it will generate the invoices at the end of each month. And if you've got any queries with payments, that's the person you need to get in contact with, or that address there. Okay. And that's the response times. It's within 7 days and resolution within 30 days. That's what they expect. How are GPs notified? Okay. Well, obviously, when you load it up on the Sonar system, it will send an email through to the GP. But if for whatever reason that doesn't work, you still need to send the GP the form manually if that system fails for whatever reason. Okay, so that's that. Now, does a patient have to be registered with GP? Nope, is the answer to that. Okay. What's this? Do I have to ask every patient for a complete to complete the survey? Well, yes, you do. If a patient refuses, you're advised to make a note of this at the back of the vaccination record form. Okay, I think you're coming up to close to the end of this now. Um, okay, well that's something you can read up about later. Here we go. Um, this is a little bit of a confusing one. I remember with pneumococcal polysaccharide. Um, there were issues last year with double vaccination. So in other words, the giving of the vaccination when they didn't need it. The idea is here is that can I accept the word of a patient they've not been vaccinated? The answer is yes, provided you clearly explain what the vaccine is, etc. Okay, and if they are unsure, you need to get the patient. Remember, there is no expectation that the pharmacy should do this. You need to get the patient to contact their GP surgery and clarify this. Okay, so they need clarification if they're not sure. You can vaccinate on separate occasions if you need to. You don't need to do the flu and the PPV at the same time, although it may be easier just to do that. You can get them both knocked out at the same time. Now, if somebody has been vaccinated in the past, there is a process by what you do. Basically, there are not going to be any clinical effects on the patient. You need to let NHS England know. You need to inform the GP's patient, and you also need to review the incident as well. Okay. Now, here there are some differences in the SLA and the PGD. Remember that the PGD covers all of the eligible groups. In other words, all healthcare professionals who can administer PPV. There are going to be some occasions whereby you're not going to come across patients who um, who are going to need the PPV. Okay, as a pharmacist, that is. So, in other words, sometimes there will be differences between the SLA and the PGD. So, sometimes, for this particular example here, those were CSF leaks and those occupational risk of invasive pneumococcal disease who are not being previously immunised, where it's unlikely that the community pharmacy will have sufficient information to be able to properly identify them. Those groups of patients are not on the SLA. So there might be differences between that and that, but don't worry too much about that. Okay, and we've already discussed a little bit about the video as well in preparation of the actual vaccine. So when that comes out, I will get all members, I'll send an email out to all members and get you to see that as well. Okay, this is an important one. Okay, I know for a fact from last year that I've come across some of the members who where the GPs didn't want the community pharmacists being involved in this. Now, apparently NHS England have spoken to London-wide LMCs and they are supportive of this service. So if you come across a GP practice who says, nope, I don't want you vaccinating, then it's a very good idea to make sure that you contact your LPC or NHS England via this and explain what's happened. Okay. And I think that's probably about it. So just coming back to the number of documents, as you'll see, whoops, sorry, wrong one. As you'll see, bear with me. I think I have. Oh, here we are. As you'll see, there are quite a few documents in here. Most of them we've sort of gone over. So you'll see that there's a Sonar login user guide. So that will give you details on how to use a Sonar platform. You've got the combined form and the local form. Remember, there are differences between the two. You've got the FAQs. Now, we've already gone very briefly over the FAQs in this sort of video, but there's a separate document with FAQs, which is essentially the same thing. You've got the instant form on that one. You've got the patient consent form. You've got the survey. You've got the PPV record form. You've got the operational guidance, which is really what we've gone over. You've got this one here, which is an update on the training requirements as well. I haven't really gone over that in too much detail, but it's a good idea for you just to go over that to make sure that your knowledge is up to date with what's expected of you. And finally, sorry about this, done it again. Got to delete those now. Okay, you've got the SLA, okay, which is the one we went over last week. So hopefully, I know this is a quite a lengthy video, but hopefully you've got a fairly good idea now on what's expected. again, if you do have any concerns, give me a shout at the office here. Alternatively, give your LPC a shout as well. You all know my email address. You all know the telephone number for here at Farm Plus. So feel free to contact us when you need to. Okay then. Good luck. As soon as I find out more, I will let you lot know. And thank you for your kind words for the video last week. It is appreciated, and it looks like we've probably found a format that works for you as well. Okay then. Take care, and hopefully see you soon. Take care now. Bye bye.